Hi, my name is Christin Lowe, and I'm about to begin my third year as a physical therapy student at ETSU. I chose to be a physical therapist and pursue a career in physical therapy because as a high schooler, I was a patient a lot, and I really appreciated how much my physical therapist worked to build a relationship with me and get me back to my competitive status as an athlete. But now that I've been on this road to becoming a physical therapist, I found that the key term for physical therapy, I think, is versatility and variety, because there's so much that you can do with physical therapy. You can work with patients as young as infants just born to geriatrics as old as you might have seen. Settings are also very different, and there's a huge variety that you can work in. The first one that I want to talk about is the hospital setting, also known as the acute care setting. And in the hospital, you'll work with patients who have had surgery. So it could be a planned surgery where they had a total knee or a total hip, or an unplanned surgery from a traumatic event such as a car accident or a fall. You'll also work with patients who have had illnesses such as a heart attack or a stroke, and you're going to be working with them for a short amount of time to get them ready to transition to the next place that they may go or transition home. The next setting that a patient may go to after the hospital would be an inpatient rehab or a neurological center. And in the neurological center or inpatient rehab setting, they'll be getting therapy for 3 hours or more a day, and that can be speech, physical, or occupational therapy. And you'll see patients that have had any number of disorders, whether they are neurological deficits or musculoskeletal injuries, such as a hip fracture or post a total hip surgery. And this is where you're really working hard to get them back to home because you think they have a good possibility of getting home. They just need more rehab. So from there, they can transition. If they aren't able to go home, they can transition to a skilled nursing facility or go straight from the hospital to the skilled nursing facility. And this is where they'll have less than 3 hours. Usually they can't handle 3 hours of therapy a day, so it's the same disorders, but they may be more disabled in their disability. And they can transition from a skilled nursing facility to a long-term care facility, or they can transition home. Now, once a patient makes it home, they have a couple options. They can be in an outpatient facility if they do need more physical therapy. And an outpatient setting is probably what you would be familiar with if you have had an experience with physical therapy, because this is where athletes go if they've had an ACL injury, or maybe a baseball player tore his MCL. So you can see that. You can also see patients who've had a stroke who are higher level but still need a little bit of help. You can see wound care anywhere here or in the hospital. And then you can have physical therapists who specialize in a specific joint. So you have specialists in back pain, you have specialists in shoulder pain, in knee pain, and then you have specialists who are manual therapists, and they are very hands-on with what they do. So there's a lot of variety in the outpatient setting. Another area that a patient can go to would be home health, which they actually don't go anywhere. They stay at home, and the physical therapist would come to them. And this is for patients who it's not safe for them to get out of their home. Maybe they're elderly and they can't drive anymore, and they don't have a way to get to physical therapy. In this case, the therapist would come there and work with them in their home, which is a very noble thing to do, I think. Wound care is a specialty for physical therapists where they can work in any setting and be specialized in wound care, whether it be someone who's had burns or a traumatic wound or a chronic wound due to diabetes. Industrial health is another area that physical therapists can work in, and in this area, we work with patients who have been injured on the job. And this can be from back pain, neck pain, or fractures, or we can work not in the rehab setting, but more in the preventative setting, which is where we teach them proper technique, whether that be lifting technique, which is very key, or how to lay out their desk so when they're sitting they have proper posture and decrease the amount of pain that they're having. Aquatics is another specialty for physical therapists to use. It's a great tool that you can use in any setting to help your patients get back their quality of life, because that's the key for physical therapy. We want to give quality of life back to our patients. And so aquatics can be used for pediatrics, and it can be used for geriatrics. So we're using that water environment to help our patients heal. Pediatrics is a very large specialty area because pediatrics covers everything from congenital disorders such as cerebral palsy, muscular dystrophy, and Down's syndrome, to musculoskeletal disorders, to any neurological deficits that come on traumatically, such as a brain tumor or a brain injury. And pediatrics, considered pediatric is an infant to 21, but in pediatrics you can have acute setting in the hospital, an outpatient setting, and in that outpatient setting you can work with any number of ages. Academics and research is another area that physical therapists will work in, but that's usually later in the career when they've decided, I'm really interested in this area and I want to find the new techniques that are out there, the new tests and measures that we're going to use. And we need a generation of physical therapists to teach and mentor the generation of physical therapists that are coming next. Some specialty certifications for physical therapists are cardiovascular and pulmonary, geriatrics, neurology, orthopedics, pediatrics, sports physical therapy, and women's health. Now, these specialties, you can do a fellowship or a residency program after you get your DPT, and you'll get so many hours in these areas working, and then you take an exam and have that specialty. I've heard the more letters behind your name, the better it is. So these specialties just give you more letters and a lot more experience. So a little history about physical therapy. We started in the late 1800s, early 1900s with the polio epidemic that left thousands of children disabled. Around the same time, World War I in the early 1900s left thousands of soldiers coming back home with these terrible injuries and disabilities. And so the demand for people to help rehabilitate them was so high that physicians couldn't take care of it on their own. So they started this physician's assistant role that transitioned into physical therapy as we know it today. So it started around that time. The military did a great job of training and certifying these individuals to be rehab specialists. And then in the 1930s, we had our first bachelor's degree in physical therapy, but it didn't really solidify and become the education that we needed it to be until the 50s. And then the transition to make it into a master's degree started in the 70s and solidified in the 90s. And then by 1993, we had our first doctorate program in physical therapy. And that's where we are today. Is the vision for the American Physical Therapy Association for 2020 is to have all entry-level doctoral or entry-level physical therapists to be doctoral level physical therapists. And currently, there's 227 physical therapy schools in the U.S., and all of them offer a physical therapy program, a doctorate of physical therapy, all of them but one. So we are very close to that goal. So requirements for a doctoral physical therapy program, you have to have a bachelor's degree. And a lot of people ask, what degree would be the best for me to get to come to physical therapy school? And really, you don't have to have any specific degree. A lot of our students, myself included, have a degree in exercise science, kinesiology, biology, a science intensive major. It's not required, but you will get all of your prerequisites most likely in those majors. However, physical therapy has been known as not only the science, but also the art of healing. And so a lot of schools like to see the diversity in their students who have different degrees. There's a guy in my class who actually has a bachelor's degree in English, and he's going to be a fantastic physical therapist. So you really want to pick your degree based on what you are interested in, because if you're not interested in the classes you're taking in undergrad, you're not going to do well in them most likely. And you do have to have pretty good grades to get into physical therapy school. So pick something that you enjoy. You do have to have prerequisites. You need 2 classes of biology, chemistry, physics, and psychology. You'll need 1 class in exercise physiology, 1 class of anatomy, and 1 class of physiology, and 1 class of statistics. You'll also need reference letters, and most schools want you to have at least 1 reference letter from a physical therapist. You won't need necessarily experience in PT because not all schools require it, but it is good for you to experience the profession that you want to be a part of. I think it's really good for you to go in and shadow PTs or work as a PT tech, because you get to know what the day in, day out is for a physical therapist. So you really know, is this the job that I would like to do for the rest of my life? The application process is pretty long, but you have to get your application in for each school that you want to apply for, and then some schools still do an interview process. And so you would have to go through an interview. A little bit about the program for a DPT. It's a 3-year program, and it's pretty rigorous, having gone through 2 years so far. You'll be in class around 5 to 6 hours a day, but there's a lot of time spent after class where you have to practice the skills that you're learning and, of course, study for exams and practicals. Your first year, you're learning mainly the basics of examination and treatment. They do like to integrate some clinical time in all of your years. The first year, you're mainly in the classroom, but you get a little bit of clinic time to say, practice what you're doing and really get to see how much you love what you're doing. Your second year, you're going to be half in the clinic, half in the classroom, and you're doing more specialty classes like Pediatrics and wound care and cardiopulmonary. And then you get to go out in the clinics and work and get to use all that you've learned and see all these amazing things. And then in your third year, you're going to be fine-tuning what you've learned with classes like differential diagnosis, where you really learn the specifics of how to tell the difference between something that's musculoskeletal that we can deal with and something that needs to be referred to a physician. And you'll also learn skills like reading x-rays in your third year and admin classes in your third year. But mainly your third year, you're going to be in the clinic. Direct access is something that has come about over the last several years. There is a form of direct access in every single state in the U.S. now, and this is mainly because we are transitioning to this doctoral level physical therapy program where we're getting these differential diagnosis classes, and we know how to look at a patient and say, you need to go see another doctor, or you are good working with me. I know how to deal with what you have. Because we started out as that physician's assistant, and we've been always to this point had to have a referral from a physician. And so direct access is making us more like a primary care provider in that patients can come to us first and don't have to see another doctor before they see us. So what does the future hold for physical therapy? There is some uncertainty about our future because of the Affordable Care Act and the changes that are happening in healthcare. But luckily, Forbes has ranked physical therapists as having one of the top 10 happiest jobs in 2011 and 2013, and it's been listed as one of the top 10 jobs in high demand because, for a few reasons, our population is aging. The baby boomers are getting older and older, over 50, and with age comes these disorders like arthritis, and so that's something that we deal with. There's also lifestyle diseases that are becoming more prevalent, such as diabetes and cardiovascular disease and respiratory disorders that we can deal with and we can help with. And another thing, our medical field has become so much better that people are living through these horrible things like a massive stroke, and people can live through it now because of the advances in our medical field. And so these people that used to would have passed away, now we get to treat and help them get back to whatever lifestyle that they can have. So, in closing, whatever you do end up choosing to do, whether it be physical therapy or something else, I wish you luck. I think physical therapy is a fantastic field, and I am blessed to be a part of it. So, good luck to you in your undergrad endeavors.